your research. Relationship and the strength and weaknesses in relation to other studies is a very important part of discussion. The common mistakes that you sometimes we tend to write that this is the first study in the world. This kind of shows your megalomania, should not be written. Emphasizing the strengths of the study more than its weaknesses, because we should never think that the reader is is not knowing anything or not knowledgeable enough to get into the details. And in this present era, when anyone can get to the access any information from the net, drawing unjustified conclusions for which there are no data, inflating selected results and reputation of the results. These are not to be done in the discussion. And while conclude the discussion, the concluding paragraph of 2 to 3 lines should mention the principal findings and their relevance and link it to the aims of the study. That should be the final paragraph of the discussion portion. Unjustified conclusions not supported by the data should never be made. Like you had said that you are trying to prove something, you haven't been able to prove it, just write that I have not been able to prove this, or there were no different, not significant, the p-value was not significant, things like that. But don't say that as it is not relevant, then something other is relevant. Don't say that, because you have not mentioned it in your introduction or your aim or objective of the study. Conclusion should not be a summary of the work done or a virtual duplication of the abstract. Emphasis should be on key points and implications. This is I am talking about the conclusion of the discussion portion. There are various statistical packages which are available now. Few free packages are available. I think most of you are aware of this. ECMA, RefMan, MetaTest, MetaTest. These are the freewares, but very commonly used SPSS software for statistics, biostatistics. This is of course not free. You have to purchase it, SPSS. Other things are there. I am also not very conversant with all this biostatistical methodology, but I think as I have said, that seminar or workshop which NB is going to hold in Kolkata in the month of April should enlighten all of you, particularly the postgraduates, regarding the research methodology and biostatistics in particular. Then these were the basic things of scientific thing. But then, like a cake, after making the actual cake, we have to top and tail everything. So there is a title, should be concise and precise. The authorship, I have said, abstract must be structured. The keywords should not be less than 3, more than 10. There should be a covering letter. The references you should keep to the essentials, the tables, graphs, the illustrations, and legends to the illustrations, and acknowledgements and competing interest. The conflict of interest should always be written in the scientific article. Now, regarding the title, the most important part of your paper, and sometimes it could be the only part, you can be sure that will be read, because most of the papers, whenever a journal comes to your through your mail, then you just see the title, and if it interests you, then only you go into the details. So title has to be interesting and should strike the reader. Used by databases for indexing, consists of keywords, should be meaningful and brief, allures and informs, avoid using abbreviations, and avoid witty or grandiose titles. Should capture the importance of the study and importance of the reader as well. In this regard, I just wanted to mention that this is the FICO approach. We all know that how, the title of a particular study can be devised. The population of interest, like in which population you are going to do the study, that is population P. Then intervention, what kind of, this of course I have given from anesthesiology, what kind of intervention or exposure you are going to do to those particular group of people, and what you are going to compare with, that is C, and then the outcomes, that is O, and what you are going to study. If you are using this vis-a-vis this, then what you are going to show to the entire world. So that is the FICO approach, very commonly used, very commonly done in many of the studies, many of the articles you see this kind of approach, and this is very commonly adopted. Then the abstract can be, because sometimes abstract writing is not so easy. It sounds easy, but it's not so easy, because to restrain yourself to 150 to 200 words is not always easy. Can be defined as a summary of the information in a document It's of fundamental importance that the abstract be written clearly and simply, as it is the first and sometimes the only part of the manuscript read. Because when it goes for peer review, then sometimes only the abstract is read. It should provide a brief summary of each of the main sections, the IBRAD of the paper, state the principal objectives and the scope of the investigation, describe the methods used, summarize the results and state the principal conclusions. It is easier to write the abstract after completion of the paper. I mean, if you start writing it before completion of the paper, then sometimes it is very difficult because you sometimes don't know about the few of the results. The criteria should not exceed 250 words, should be written in one paragraph. There should not be more than one paragraph in abstract. It should be written in the past tense as it refers to work done. Long words should be followed by its abbreviation, which would be used throughout the abstract and paper. Then it sort of shortens your writing. It should not cite any references except in very, very rare cases. It should never give any information and conclusion that is not stated in the paper. Must be accurate with respect to figures quoted in the main text. So whatever percentage or whatever you are writing, milligram, gram, etc., you should be very careful that you have written the same thing which you are going to write in the full text. Then comes the references. You should include only relevant, accurate and complete references. I mean, you have heard something in some lecture or you have read somewhere in the CME journal or things like that. You should not kind of cite it. They are not peer reviewed and particularly they are not indexed also. So those non-indexed, non-peer reviewed citations may not be valid in the when it is your article is peer reviewed. One or two references, PowerPoint should suffice. Do not over self-cite, numbered consecutively in the order in which they are first mentioned in the text. That is the Vancouver system which we all follow. Format as per guidelines, check with the journal style. Each journal has its own style. They always give it to the authors, like how you should send it, how you should prepare it, and things like that. Titles of journals should be abbreviated in accordance to the style used in Index Medicus and refer to citation format. For the Vancouver style, you can go to this particular site and you will have it all details there. There are two basic styles which we follow. One is Harvard reference style and another is Vancouver style. So a quick word about these two styles. The Harvard reference style uses the author's name and date of publication in the body of the text, and the bibliography is given alphabetically by author, like this. Adams AB, then 1983A article title, then the subtitle, then journal title, whatever volume, then supplementary, and then the pages. It's the Harvard reference style. And the Vancouver reference style uses a number series to indicate the references. Bibliographies list these in the text you have written 1, 2, 3, 4 like that, and in the bibliographies list these in numerical order as they appear in the text. Then again Adams AB 83, you need not write AAB or things like that because that is not mentioned in the text. Then subtitle, then journal title, then supplementary this and then the page, in which pages they appear. And these are the few websites where you can actually go and see for yourself the details of how should go ahead with referencing all your texts. International Committee of Medical Journal Editors uniform requirements for manuscripts submitted to biomedical journals. Then how to cite references, Vancouver style, Murdoch University, Australia, Blackwell Publishing online references and BMA reference style. These all will be available. I mean, Dr. Samudra is already taking it, and more so anyone wishes to take it from me, free to share this with all of you. And lastly but not the least, illustrations should be very important, and according to the Helsinki Declaration, the photographs of patients are used and the written permission for publication should always be obtained, and figures should be self-explanatory, and like the child shown here, the eyes should be covered so that the identity is not actually shown. So that is the way you should use your photographs after taking the written permission. If you are still with me and not bored enough like this particular animal, then I will go ahead with a little bit after your preparation, like how you submit and prepare your